Has your doctor ever said, well, it must all just be in your head? Well, hopefully that's never happened to you. But the more common scenario is you have a symptom or a set of symptoms that you've had for maybe several months or even several years, and you go in to see the doctor, and the doctor maybe runs a whole bunch of tests. Then you come back to see him, and the doctor says, well, all your tests are normal. I don't know what's wrong with you. So what's the problem with that? Well, here's the problem. If you've had symptoms persistently for, especially if they've been there for several years, and you don't get them fixed this year, guess what? Next year, I can pretty much guarantee that they'll be even worse. And not only that, eventually you'll probably, very high likelihood, develop a chronic illness. Let me give you an example of this. I had a patient once that struggled with this racing sensation that would just come out of the blue every several times a week. Started when this patient was in their teenage years and just continued. Never could figure out what was causing it. Went to probably dozens, or at least a dozen doctors, including a couple of psychiatrists. One psychiatrist said, well, it sounds like it might be bipolar. Let's try a medication for bipolar. And unfortunately, it didn't work. So one time this patient came into my office and said, Doc, you got to help me. Now when I have this racing sensation, it feels like somebody's squeezing my windpipe and making it difficult for me to breathe. So I said, well, that sounds like your thyroid may be squeezing off your windpipe. So we sent this patient for some very detailed thyroid labs, and sure enough, this patient had an autoimmune condition of the thyroid called Hashimoto's thyroiditis. Well, the story does have a happy ending. We had I'll say a heart-to-heart talk about nutrition. This patient would readily admit not that great a diet. So the good news is this patient was willing to change their diet, even to the point of giving up gluten and even sugar and dairy and some of those really tough things for people to give up. But she was motivated because she really wanted to get past this symptom. So at any rate, this patient's doing well now. This just illustrates the point that I'm trying to make, that if you're having symptoms, even if it's difficult for your doctors to figure out what's going on, don't give up. Keep doing your research. There is help for you. There is help for your symptoms. We have more scientific evidence than ever before of what actually is the root cause of chronic illness that can actually be implemented into a patient's situation to resolve or at least improve essentially any chronic illness. So if you have any questions about that, if you'd like to run your case by us to see if we can be of help, feel free to click the button below. We're happy to hop on a call, a complimentary call with you to see if we can be of help. At any rate, don't give up. Keep pushing. There's a way to help your chronic illness or your chronic symptoms. We'll talk to you tomorrow.